Good afternoon. My name is Amy Washam, and I'm the director of Northwest Missouri State University in Kansas City. I'm also a member and education co-chair for the Northland Education and Business Alliance, or as we so lovingly call it, NEBA. NEBA is a network of education and business organizations in Platte and Clay counties, whose vision is to promote and provide business-driven educational opportunities for you, our next generation of business leaders. I'll be your host during this session today. Just a few quick notes before we get started. The session will run for 40 minutes with a hard stop at 40 minutes after the hour. Our industry expert will begin by stating his professional history and insights, but feel free to make this a conversation. At the bottom of your screen, you'll notice there is a Q&A feature option. We encourage you to use this to post your questions that you might have some point throughout the session. We might not be able to get to all of them, but we will do our best. When the session ends, you'll be asked a brief survey to complete a brief survey. So please give us feedback so this will better help us host future events that are relevant to you. And so we will also record the session, and it's available on our NEBA YouTube channel in the near future. So let's get started. Hello, Aaron. How are you doing today?
Hey, I'm doing pretty well. Excited to be on this presentation and speaking with everyone.
Awesome, thank you. So could you just tell us a little bit about yourself and your career trajectory to getting into marketing?
Yeah, absolutely. So I currently work as the Public Information Officer here at the Platte County Health Department. I've been in this role since July of last year. I have about 8 years public relations, marketing, and fundraising experience. And I got my PR start at a nonprofit food bank here in the area. Started out as a PR coordinator at 20 hours a week. And then as time went on, got promoted, was brought on full-time as a PR specialist. And then I eventually left the organization as the director of marketing. Also in that time period, I did about 6 months of fundraising. So I was the interim director of development, and did fundraising, grant writing, that sort of thing, stewardship of our donors. I do have experience in, of course, nonprofit communications, corporate comms. I worked here at a large health IT company in the metro. I've worked in government, so another health department as well as a local police department in the media relations unit. And then my current career, like I said, I was working in healthcare, patient care, believe it or not, prior to getting into this role. So I have probably about 6 years of direct patient care experience, and I did that because I thought I wanted to work in healthcare administration. So I was like, you know what better way to kind of get into that world than going back into the patient care side, understanding what the nurses and techs and everyone else does, to be in an upper level role to understand operationally what everyone's doing in their different departments. As one can imagine, healthcare is a hard industry, taking care of patients. I did adults, and then I also worked in the pediatric population. So it's a very demanding area. And unfortunately, I was actually hurt on the job. And so I did some self-reflection and thought, I really miss the PR marketing world. And I was very fortunate to find the opening here at the Platte County Health Department. Went through the interview process and got hired. And like I said, I've been here since July of last year. And so I think my main point with that story is you don't have to have your career totally figured out. I thought I did, kind of did a little twist and turn and got back to really what I loved, like I said, was the PR and marketing side. And so I think the main point is, like, you don't have to have it totally figured out, because I thought I did. I didn't, but I was able to really think and reflect and realize that I love the PR side and particularly the government side. I really like that.
And you ultimately have to love what you do if you're going to want to go to work almost, 5 days a week or whatever your schedule is. So
absolutely, very true.
So could you start off by framing for us the Platte County Public Health Department? So could you kind of tell us, what the mission, not the specific mission statement, but what your mission and your goals are as an organization, to kind of frame, how the marketing works into that aspect?
Absolutely. So at the end of the day, our mission involves prevention, promotion, and protection. Basically, protecting the health of the citizens of Platte County. And of course, all those that visit the area, because we're home to Riverside, Weston, Parkville. So there's a lot of visitors that come into our area. And so it's really our goal to protect them from public health threats, whether that's, of course, COVID, things like the flu or foodborne illness when they go to a restaurant. We've got inspectors on duty that do that. So we're a fairly small organization, about 55 staff or so. And I am a team of one. So I do all of our PR, marketing, graphic design, website management, social media, a little bit of everything. And so, day to day, what that looks like is it's responding to comments and questions on our social media, or we might be updating a form or posting something on the calendar, vaccine clinic, updating our website, designing, I'm working on some postcards now or annual reports. We're doing a brand refreshment initiative, colors and fonts and logos and that sort of thing. And then it's also working with our individual departments, whether it's environmental health, community development, or our clinic side, working with them on their marketing needs. So again, it might be, we have an upcoming, flu drive-through clinic we did last year. So getting all the literature together for that, working with our media partners to get the word out, doing interviews, or it could be as simple as we need a postcard to send out to remind clients to come in for their annual wellness checks, that sort of thing. So some days can be very crazy around here. We might be, like I said, out doing clinics and that sort of thing. I'm taking pictures, managing media relations. A lot of the response that we're doing has been COVID related right now, but of course, we're so much more than the COVID response. We're doing other vaccines. We're having folks come in for doctor's appointments. Our health inspectors are out inspecting restaurants to make sure folks that don't get sick. Our community development team is working with our community partners to get the word out about what we do and expand initiatives such as seatbelt usage, underage drinking, that sort of thing. So we're all working together to better the health of the community that relies on us. And probably a little bit more than anybody cares to know, but we are funded by a tax levy. So the taxpayer pays money on assessed personal property. So at the end of the day, we're accountable to the taxpayer. We're going to make sure that we use those resources wisely in fulfilling our mission.
Absolutely. Here to serve the community and the people. That's amazing. So you kind of already you talked about like your normal day would look like. So in thinking about those tasks and duties and how it's very different across different types of tasks. So what do you think are some of the most essential skills or transferable skills that someone would need to be successful in a career like yours? That could be soft skills or durable skills. There's lots of names for those kinds of a little more intangible things. So what would you recommend for someone that was interested in your field?
Yeah, absolutely. As far as skills I recommend that are important for someone working in this type of field, you have to be able to communicate well. Communications, PR, you have to be able to communicate well. We work with so many different people in our organization and outside of our organization. And for me, I have to be able to communicate with all those partners, our internal stakeholders, from our nurses to the management team, all the way up to our director and our board of directors, and then also our public. So we have citizens, emergency management partners, law enforcement, other health departments. So we have to be able to speak to those partners well in a way that they can understand. Being able to write well. I do a lot of writing here in my job. And so being able to write well and oftentimes take very complex and complicated information and write it in a way that the public is going to understand. We get so much information here from our local, state, and federal partners, and oftentimes it's very, very complex. If I were to take that raw information and put it out to the public, nobody's going to understand that. It's complex, it's full of jargon. And so it's taking that and thinking, how can I take this and get it to a way that someone that doesn't know all that lingo and that complex information to be able to understand it and take action on it. And then I would say being flexible is important, especially right now. You may have your calendar set to do X, Y, Z, well, guess what? We're doing something different today, and we're responding to something. Again, it's been a lot of COVID, but we have other things that are happening, other events that are going on, other public health issues that we're monitoring. So you have to be flexible and adaptable on top of that. Um, I certainly think those are critical skills to have to be successful, not just in my role, but if anyone's interested in PR marketing type work at all, those are certainly critical to be successful.
Thank you.
Mhm.
So you have kind of touched on your trajectory across, a couple different major sectors.
Sure.
And so on the PR and the marketing side, are there courses or certifications or degrees that you would advise that someone look into if that is something they wanted to do? And then we can talk about the healthcare piece of it afterwards.
Yeah, absolutely. So as far as courses, degrees, etc., so I have a bachelor's degree in liberal arts, and I concentrate in communication studies. So most PR, marketing, PIO jobs are going to require one to have a bachelor's degree. And then I went to grad school, and I have a master's in management with a concentration in healthcare management. The reason for the business degree is because it's important, especially I've worked in the corporate side, it's important to understand that business lingo and the bottom line, so dollars and cents and operational challenges, to make sure that you can speak that lingo of the executive or management team to understand what's going on and how the marketing component can fit into that and potentially fix that operational problem. Or, we're not selling enough gears, and understand that process, how we're getting that. Oh, well, marketing can come in and help with that. And then I picked up a certificate in professional fundraising. Again, working nonprofit fundraising is key to your operations and your programs. And I'm also in school working on a master's in strategic communication. So, entry level bachelor's degree is likely going to be required. Communications, PR, journalism, strategic comm, convergent media, that sort of thing would serve someone well in this type of role. And then as far as certifications, there's not a whole lot in the PR world. There is one that folks can get. It's usually there's two tracks. So there's one for students. It's through the Public Relations Society of America, and they have like a certificate in public relations. So it's an entry level credential as you're coming out of school. And then there's also called the APR, accredited in public relations, and that's generally 5 or more years of PR marketing type experience. You apply, you go through a panel interview, and then you have to take a written test. But outside of that, there's not a whole lot of certifications that a PR practitioner could get. A lot of it is your education and then getting into the field and working, and you just kind of learn by doing and writing and seeing what things work and what things don't, how to be better strategic, that sort of thing. And I tell students and new professionals that if you ever get to this role and you think you're done learning, you need to do something else. It's truly, based on my education history, I love to learn, and it's very important in this world to still have that mindset. Technology is changing. We've seen with social media and that sort of thing. That continues to change, and how we reach people continues to change. So it's important to have a desire to continue to learn and further your education.
Awesome. Just kind of curious, when you were starting out, either part of your bachelor's degree or right after, did you do any type of like an internship experience?
I did. So I did an internship at the food bank where I got hired. So, I did some writing, news release writing, that sort of thing. And that's actually what led to my first PR job. So the individual that held the PR role, I decided to step down. She wanted to be a full-time stay-at-home mom. And so I was approached and was, of course, interested, being my first real job in the industry I wanted to get into. And so, yes, I did an internship. And like I said, I did enough good work that they were interested in bringing me in. I said it was only 20 hours a week, but that eventually led to a full-time role. And like I said, I left as the director of marketing. So I was able to progress up the chain of that organization. So especially in the PR marketing fundraising role, internships are critical. They allow you to gain valuable experience, and you can try, agency life or nonprofit life or, the government side, and maybe say, oh, I was a junior in college, I tried nonprofit. Maybe that wasn't for me. Senior year, I did an internship at an agency. That was a much better fit. And you never know, that could lead to your first real job outside of college in the industry that you want to work in.
Yeah, internships are almost like a pre-interview interview.
Yes, absolutely. I totally agree. If you're doing a stellar job and I have a spot opening, you're probably going to be my first consideration for that.
Yeah. And especially when you know how the personality fits and their
Right.
work, the nuances of how they work in the environment with the other colleagues and that sort of thing. So wonderful.
Absolutely.
And so you mentioned you were in patient care before. And so if we don't want to go like terribly deep, but just in case anyone was curious, what certifications and degrees and that sort of thing do you find was beneficial, especially when thinking about moving into that master's of healthcare management piece?
So I think as far as having a healthcare background, it allowed me to understand some of that coursework and what was going on. So it was health IT. So like the medical chart of the doctor's office, quality patient care, IT, that sort of thing. So allowed me to better understand that. And looking back and having that experience, of course, I'm not a direct caregiver. I'm not the one that's giving the vaccine to someone, but I understand what's going on in their world because I've worked in it, and so to speak, be able to talk shop and understand those things that are going on and the challenges that happen in patient care, because that can be a unique setting, and working with patients can bring its own set of challenges. So I think having that patient care background certainly helped. So it helped a little bit in the master's program, but that's not why I pursued that. I think it helps more in day-to-day work, and understanding what we do and being able to understand the challenges that our clinical team is facing. So I think that's where that benefit comes in, is more day-to-day working and understanding versus me going and get a master's in healthcare management. Like I said, I did the management to better understand that business side, but healthcare has always interested me. So that seemed like an appropriate fit for me to kind of tack on that concentration.
That's awesome. Yeah. And you don't always think of those degrees going together, it's a
Right.
unique aspect, but if you find something that you love and that you're passionate about, it's okay that it doesn't, match as the catalog says, the catalog is not the people. So
Absolutely.
So opportunities for promotion within in the marketing realm. We talked a little bit about that internship piece. Do you see a lot of people moving on to a different organization to promote, or is there a lot of promotion from within? And how does that typically work?
Yeah, for someone like me working in the health department, so I'm a PIO1. Our next step would be PIO2, which means public information officer. I just want to be clear what that means. I realized I said it earlier. And so that would be the next step for me, would be coming 1 to 2. And I have no desire to be like our director or deputy director or anything like that. So inside other organizations, there are opportunities to move into further roles. Even in the government side, you might start out as a social media specialist or digital media specialist, and you might be, a manager of the digital side, and then eventually maybe the director of the entire department. So there are steps. I said in the nonprofit, I started out as a specialist, interim director of development, and then director of marketing. The health IT company I mentioned, I was brought on as a senior coordinator, but the next step would be like a partner, a senior marketing partner, or communications partner, senior communications partner, and then a management type role. And of course, there are VPs and that sort of thing at a very large corporation like that. So it really depends on the industry that you're in. So I'm happy here being a PIO. As I mentioned, I have no desire to be the director or the deputy director. So I'm happy in the role that I'm in and very fortunate to be in it. So it really just depends on where you work and what that career ladder looks like.
Mhm.
It varies widely, and the agency world is a good example of that too. That you might be brought on as a um, an account coordinator and then promoted to an account executive and then like a senior account executive, group director, manager, VP, business development. There are a lot of different roles inside the agency, especially the bigger the agency. And here in Kansas City, we have several large agencies that have a national footprint. So yeah, it just kind of depends on where you're working.
Awesome. Wonderful. And so what do you love about what you do?
I love that I get to help people, and like I said, I'm not the one that's directly giving the vaccine, but I got the word out to someone that says, "Oh yeah, I heard about it. You were doing this clinic at your office. I can come be vaccinated against whatever that may be," or "I didn't realize you had a public health clinic. I can go and access a service that I need." So it's rewarding in that aspect that I've gotten to connect someone to a service that they need or want. And so I enjoy helping people. A lot of my career has been devoted towards that, and of course, the patient care side is that direct hands-on. But I've always enjoyed helping people, and so I get to do that here. Like I said, not directly. I'm not the nurse or anything like that, but I'm behind the scenes working on those things to connect people to resources.
So how do you typically, what methods are you using to communicate to the broader public? Whenever, for instance, you have a flu vaccine clinic, for instance, how are you reaching out to them?
Yeah, so we have multiple channels that we use, social media being one. We have our website where we post information as well. We reach out to our media partners. So we have 3 newspapers here in the county. And then, of course, we also have our TV stations, the Fox 4s, KCTV 5s of the world, and then some other like digital publications that reach out to us. Then we also reach out to our partners to distribute that information. So it might be a food pantry, a church, our school district partners, and then our community development team are working with, again, additional partners to get that word out. So it's multiple channels that we're using to distribute information to the public. So it can be any number of those that we utilize to disseminate a message.
So yeah, your messages are definitely formulated in many formats, many types, many channels,
Right.
to reach all of those sectors of people. That's really good information. And I'm sure that the messaging itself is probably changes slightly depending on the modality that you're using to communicate with them. Because I'm sure something on TikTok may be very different than the pamphlet that you're handing out, in a community group or something. So
Right. Absolutely.
wonderful. So I'll make this a 2-part question.
Okay.
So pre-COVID and post-COVID, I kind of prepared you that I might ask some pre and post-COVID. So what, I guess during COVID, what was the most challenging thing about this position?
Oh gosh. I think one of the biggest challenges being in COVID as a PIO in a health department is understanding the information to communicate to the public. It was a constantly changing sort of thing. And so we're trying to keep up with what's happening and making sure that we're communicating the right information. We're getting feedback from the public about that too. Some folks are really happy to hear from us, some folks not so much. And so, but at the end of the day, it's our job to get that information out to the public and so they can take action against it. So I think definitely just the volume of information that we're getting in, doing the interpretation and then rehashing it in a way that someone can understand is certainly a challenge for sure.
So if you were thinking about when we can let the COVID rest a little bit more, what do you think could potentially be challenging in your position after we get over this pandemic talk, do you foresee anything, or even maybe in a previous career, you could address, the pre-COVID challenges in marketing and PR?
Yeah, so I actually worked at a health department, another health department, when well before COVID was a thing. And so, I think day to day, you're still trying to get messaging out about what you do as a department, because we're still offering services. Environmental inspections are going on. Folks are accessing public health clinics and other vaccinations. So you're still wanting to get that messaging out. But things are still coming up. I've experienced other outbreaks, Ebola. There was a disease that happened, a waterborne type disease that happened that we were investigating when I worked at this other health department. So you're developing messaging for that. So, I think you're still trying to do your day-to-day mission and talk about all the other things that are going on. And we're even trying to do that now. Like I said, our people are still doing their everyday job the best they can. And of course, still responding to COVID. So it's still telling that story that we're still here doing all these other things. But COVID is just part of that, and so I think that's kind of, a pre-look, so to speak, of you're still talking about your programs and services and, what's going on.
It has to be very nerve-wracking to feel as though that you're bringing bad news, but that you need to inform people because they have the right to know, and you want them to take any measures they deem necessary for their own safety and the safety of their loved ones. So
Right.
I could imagine finding the appropriate level of urgency
Yes.
could be pretty challenging, and to make sure that that it needs to be heard, and understood. I could see that being the messaging being very tricky, I think.
Yeah, absolutely.
Say that. So what do you find to be the most rewarding? We'll say within the public health sector, and then just in your marketing positions prior.
I think in the public health sector, the most rewarding thing is, we're really doing important work. Again, is it vaccinating someone? Is it helping a family access care, whether that's with us or somewhere else? Or, we're making sure folks that are visiting one of our food establishments in our jurisdiction aren't getting sick. It's my job to tell that story of what we're doing. And so I think that's very rewarding, knowing that I'm part of an organization that has a mission and a job to help people. And I know I mentioned earlier, I've always had a passion for helping others. And so I've been able to certainly fulfill that mission in the public health world. And then as far as, other PR type jobs, I think it kind of depends on which one it was, because a lot of them do tie back to helping people. Again, it's not that direct. I'm the one in the hospital using the charting system, or I'm not the one that's giving the vaccine directly. But I think it's, helping people, and then I've also had the chance to tell the organization's story, so folks have a better idea. Folks having a better idea of what the organization does, and a better understanding of what's done each day, and where their dollars go, whether it's a nonprofit or a government organization, being part of that story.
So prior to your career, how did you decide to get into the marketing arena? Were you a storyteller prior? Was that an interest?
No, it's funny, because I worked in patient care long before I got my start in PR and marketing side. And so, as I mentioned earlier, it was a challenging area to work in. And this is well before COVID. It was a challenging area to work in because healthcare is hard, patient care is hard. When I first went to college, I thought I wanted to do nursing. And so I enrolled at the local university in St. Joe, and was a pre-nursing major. Started taking some of the classes. I was working in healthcare at the time too. And realized, I don't think this is what I want to do. And so I thought, well, I like talking. What can I do with that skill? And so I came across PR. I took my first PR classes. So I took a intro, like a basic news reporting class, and then I was writing for the school's newspaper, and I really loved it. It was really cool to see something that I'd written with my byline published, and learning about the different PR sides, Associated Press style, which is the journalism PR writing tool. And so I enjoyed that and went on, got my internship, really liked it. I decided that's what I wanted to do. And I said I did the PR side for several years, thought maybe I wanted to do a transition into the healthcare administration side. Again, went back to patient care and the children's pediatric side. And then I did, a mixed patient population, pediatric, adult, and geriatrics, or older individuals. And, so patient care was not really what I wanted to do again. And as I mentioned, I unfortunately got hurt in that area. And so I wanted to get back to what I knew that I enjoyed, and where all my education was, and everything that I kind of worked towards my career was all geared towards. Like I said, I really was hoping to get back into public health because I missed it. And so I was very fortunate to find this role here at the health department to come on as their public information officer.
So in thinking that we'll probably have quite a few high school students that are watching our recording or joining us, what is maybe something that they can pursue now, maybe in high school or soon after, that would besides just an internship with an agency, are there particular classes in high school that could open up, or clubs or organizations or something that young people can start participating in?
I think from a high school perspective, would be looking at your yearbook would be a great opportunity. Whether that's the writing side, design, photography, that sort of thing. I think that would be good practice to see, okay, is this something that I'm interested in? Because I take pictures, I design, I write. So if you don't like the yearbook class, you're probably not going to like a career doing what I do, truth be told. So, I think it's looking at yearbook, or if there are any, ad clubs, that sort of thing, kind of looking for those opportunities. And then also, maybe your high school doesn't have that sort of thing. Looking at volunteer opportunities, reach out to a local nonprofit. Yeah, I'm interested in helping with photography or maybe a little PR. They're probably going to be interested in talking to you because they're oftentimes very small staffs. A lot of places, they do not have a marketing person. So it's spread amongst a lot of different people. So they have someone that they can rely on for a little bit. That's a great opportunity to kind of put your foot into the water too and say, well, yeah, I really like this. And of course, going from high school to college, again, you'll be able to, there might be a newspaper, they'll be able to work on, a yearbook. You'll be able to start to take some of those PR, marketing, journalism, photography type classes, videography. So that would be my tip to younger students, to kind of look toward those things.
Awesome. Well, thank you so much for your time today. I appreciate getting to learn about the marketing aspect in a little bit different arena than maybe we're always thinking of an ad agency or
Sure.
something of that nature, because everyone needs their story told, and including county and city level departments and agencies and that sort of thing. So I appreciate your time today. And I think we'll just go ahead and wrap up. So I just want to remind everyone to be sure to take a minute or two to complete the survey at the end of the session that'll pop up on your screen. This is going to help us to better these sessions for you in the future, to make sure that we have helpful and relevant content. For more information on educational programs and career opportunities related to marketing industry discussed today, please be sure to visit www.nebaworkskc.org. That's nebaworkskc.org. Be sure to register for future NEBA events and visit our website. Have a great rest of your day.